King's only. Lovely. Cheers, bye.
Adult trauma call, 8 minutes. Adult trauma call, 8 minutes.
I've got an unconscious gentleman. He has severe traumatic brain injury.
King's College Hospital, London.
I think something hurt.
One of the busiest A&E departments in the country.
They're a bit busy right now. Yeah, 15 minutes, 30 minutes.
King's is extreme, isn't it? Come on.
A place where love, life and death unfold every single day.
Fall from a tree. It's probably absolutely trolleyed.
I'm very drunk.
I just keep thinking, how am I going to cope?
All the patients you're about to see were treated in one department in just one 24-hour period.
Kevino. Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush, rush, rush and the money, money, money. It's the people you love and the fact that 1 minute they might be there and 1 minute they might be gone.
I'm one of the technicians. We need to take some blood from you, OK? What's your name? Obviously, people are very anxious and nervous and scared when they come into a department like ours and they don't know what's going on, and it's quite nice to sort of put them at ease, which I think that I do very well. So, sharp scratch. You can open your hand, don't move your arm. Thank you. When I see couples come into the department, it just makes it more real. The emotion is more real because you're dealing with two people and, you know, one person, the patient, is in agony, but also their partners are feeling their pain as well and get quite upset. Sometimes we see people on their own as well, and sometimes that makes you feel a little sad.
Claire? Hiya. We'll check your blood pressure.
OK.
Just while you're waiting.
All right. You don't want to take this off?
22-year-old Claire has come in alone after being knocked off her bike.
So what happened today?
I was cycling along and then a man on a scooter decided to crash into me. And I sort of went forward on I kind of went on my face, so hence the teeth. And yeah, you know, that's it really. It all kind of happened very quickly.
Okay. I'll get you something for the pain, okay?
Thank you.
Okay, Dr. Kennedy, please call 2410, thank you.
I remember being in the hospital and kind of seeing lots of couples and sort of thinking about that and kind of how they must be worrying about each other. When you're part of a couple, it's simultaneously this really, really good thing, but it's also a huge gamble in that it could end very, very easily and suddenly.
Got some paracetamol and some. The briefing help with the swelling as well in your knee as well. But you don't have to take them all in one go. You can do
My boyfriend, he was killed in a cycling accident. It's been 10 months now. He was on his way to lectures. He was a medical student, and yeah, he died instantly at the scene. So no, I never had to go through the sort of going to hospital. And I don't know. I mean, I'm not sure if I really know how I feel about that. If I'd have rather have had a chance to say goodbye or not. But yeah.
John and his wife Brenda have been together for 29 years. At Brenda's insistence, John recently had a private health screening. The results have sent him straight to King's.
So just to reiterate, I just need to get the story right in my mind. Seen on Friday privately, did an ultrasound scan of your tummy. Take me back in time a bit. Why were you having the ultrasound scan? What were they looking for?
Routine health screen.
Oh, routine health screen.
My name's Jackie Butler. I'm one of the other A&E doctors. Sorry, I'm going to just have a quick look with our ultrasound machine as well. So I'm going to lie down a bit flatter. Is that okay?
Yeah.
People can actually come in and physiologically be quite unwell, but because there's still enough blood pressure to circulate to the brain and the skin and all those sorts of things, they don't necessarily appear sick. Okay, now I'm going to try not to press too hard.
John's health check revealed an aortic aneurysm, a dramatic swelling of the body's main artery.
Okay, so you're going to feel a big scratch in your arm. It's just going to pop a little needle in and take some blood.
So, you know, someone can come in and go, oh, I've got a bit of belly pain. Their numbers can all be basically fine. And then they have this big balloon of a aorta, which at any moment could literally pop. And if it pops, then that can be the end of you. No, that health check was worth having. It was money well spent.
Yeah, sure.
How much did it cost you?
I think it was around 140 quid.
Best £140 you ever spent, I reckon.
Well, you know.
I had a funny feeling that there was something wrong. Didn't know what it was. Couldn't put my finger on it. I mean, I had to persuade him. You know, John's very, oh, I'm all right. But I got him down there, and I mean, they said to him, you are just a walking time bomb.
Did you want to sit up a little bit?
He's got a AAA. He's got an aneurysm. Yeah, he's got an abdominal aortic aneurysm. He's been picked up incidentally on Friday. They've just done a scan, just routine, and they found it. It's about 8 centimetres in diameter. So yeah, it's big.
Vascular registrar Ranjit has been brought in to assess how urgently John needs an operation.
So guys, if you can see, I'm just holding, this aorta normally runs down there, and I actually got my hands around it, so it's that big. And can you see my hands are just being pushed away from each other, kind of a pulse. That's his pulse. So you see, it's that big. You can see it's 10 centimeters, okay? Yours and mine, it would be about that, about 2 centimeters, basically. Okay, so it's quite large. It needs urgent intervention. We're going to get the cardiologist down, as I say. All right, so I'm going to go to the meeting where we're going to discuss you. I'll come and we'll have a talk to you, okay?
I'll deal with you. Okay.
Dad had some quite colossal accidents. He's competed with bikes all through our lives. But Dad being Dad, he's got up and walked away and come back and done it again.
Well, you better get going or you'll all get hooked up in the traffic.
We're not going anywhere, shut up.
Stop worrying.
We're here until we find out what's happening.
Well, you know what's happening.
No, we don't. Haven't had a meeting yet.
He likes talking bikes. He likes to be able to get his say in, which he does tend to sometimes get, I suppose, talked over.
We weren't making a fuss for nothing.
No.
I mean, every time I dragged him up the doctor's,
I was able
it was like, oh, well, you know, we're checking on him, he's all right.
I was able
And there you were, threatening to mow the blooming lawn the other night.
That's all right, the lawn takes me round, doesn't it?
Yeah, just what we need at the moment, isn't it?
Forward.
Could have caused that to go, because, I mean, you might have pushed enough pressure on it.
Not my bad to get a brand, that's what I call it again.
When I did see couples in the hospital, I was kind of aware that it must be this really intense period of their lives. When I was a child, I used to find it quite fun going to the hospital. And now it's a bit of a scary experience. Having my own accident really kind of put things in perspective. I don't cycle anymore because I'm sort of lost too much to cycling. I don't want to lose anymore. We do forget how vulnerable we are. So I guess, yeah, just to remember that, really, and also sort of think about how the risk you're taking are impacting on the people who love you.
What kind of sandwich would you like? What kind of sandwich would you like? Tuna, chicken, ham, cheese?
Cheese sandwich.
Cheese.
Must eat something for the last week.
Cheese with a salad. And we do meal deal for $3.49 with a drink and a crisp. $3.49 with a drink and a crisp. We do meal deal. Yeah. It's a hospital kind of thing. Means everybody plays their parts to make sick people to get better. So would you like a drink and a crisp with it?
Yeah, what's up?
Okay. Something non-fizzy?
Not sweet.
Not sweet. Sugar-free. I wish I could be a doctor, but I'm still thanking God. I'm in a good health, with a good family, and playing the part as a doctor plays to getting people better. Thank you very much. 151.
Body is the most incredible thing.
It's the cure-all.
Oh, that's the most thing.
I know, you use it for cleaning and everything.
I told Roly and Leader that, they won't believe me. I said, use it on your surfaces, you won't believe how shiny they'll come up.
Oh, it's been notorious for that for years.
Oh no, it's on, it's oily. I said, no, it's actually a disinfectant. I said, it's terrific. It's the only thing I know that gets my black surfaces shiny and not smearing.
.82-year-old Freda has come to hospital on the advice of her GP.
Hello. Come through.
Thank you. Thank you, nurse. Thank you.
Okay. So, I'm Nancy. I'm one of the nurse practitioners.
Yeah.
What's the problem?
This is the ear of mine. The ears seem to be blocked up.
Feels like they're blocked. All
yeah,
right.
there's something in that ear that I don't know what it is.
Okay, I need to have a look. I'll just go and get the right equipment. All right.
Dear.
No, Nance, can you tap?
Can I tap? No, I've never done tap.
Emma's thinking of doing some tap dancing.
Oh.
There's a place on Tuesdays. Listen, I'm a bit heavy-footed. I need a man to dance with. Tap, you dance on your own a bit.
Dance on your own?
Yeah, well, that's no fun.
Jill's done it. Jill's done tap dancing. She did a little exhibition at her.
I want to be in hold, like they do on. I love it, like their hands. How do they do their hands?
I know.
Well, they're all like,
yeah,
and their heads swaying, and they're this way. Oh,
you better find some ballroom dancing classes.
yeah. Alan, do you fancy some ballroom dancing?
Oh, that's sore, isn't it?
Oh.
Sorry, sweetheart.
Oh, that's sore.
Yeah. Oh dear. You do have an infection in that ear. All right. So I'm going to give you some different antibiotics and some ear drops to put in your ear as well, and hopefully that will settle it down for you.
Okay.
Hello. How are you? I'm good. Yeah. Call the blood lady me. If you need anything.
I will. I'll try not to.
All right. I wouldn't do my job if I didn't feel it was important You know, I want to feel wanted and important. Andrew, I just need to put another cannula in your arm, just so we can give you some more medication, OK? My career is... I'm giving up my life, really. Well, I'm not giving up my life, but I'm dedicating my life to other people. You just keep your arm still there for me, and that gives me a reason, or a good reason, to get up and get out of bed and get to work, because I know that someone needs me. Someone will need me potentially today, tomorrow, and that's a great motivator.
Yeah. I feel absolutely exhausted.
How the doctors are, they're not doing nothing now. I want some service.
Just come and assess me, please. Get me down to X-ray, quick, please.
Patrick has been waiting to see a doctor in Miners for 20 minutes.
You know what I mean, babe? I ain't looking to stay in here all day.
People's expectations are that, you know, obviously they are the most important person. They can't think about anyone else. So, you know, they just want to be seen and sorted as quickly as possible.
Excuse me?
Yeah, no problem, baby.
Excuse me? Can you get someone to examine him, please?
All right, then, sweetheart. Yeah. All right, then, I'll ring you back, all right, darling? Yeah, all right, then, baby. All right, take care. Bye-bye.
Hey.
OK, you can look after me now, yeah?
Could I ask
I'll ring you back,
one
yeah?
person to stay, please? Otherwise...
I'll ring you back, bro. I'll ring you back.
Good. What happened?
I don't know, really. I just stepped up a step. You know what I mean? I must have lost my footing somehow.
So it was twisted, basically.
I think I've
nothing
twisted
fell
it.
on it. You
No,
didn't stumble and
no,
fell
I've
on it.
fallen over on it. Oi! You'll do it.
Ah, you see? As soon as you come outside, real air, man. That fucking recirculated shit going around in there. That's why all the fucking old people catch the old superbug. The old MRSA, RSI, whatever.
Such a dickhead.
Let me talk to one of our orthopedic surgeons, what they think, okay?
Thank you.
Can they come back in now? They can come back in now, innit?
Yeah, I reckon so. Why not? just sit that so you can examine me. That's it. You know what I mean?
Where are they?
You know what I mean? I feel my thumb on.
"92-year-old widow Eileen lives alone. She's been brought to hospital after falling and spending the night on the floor.
Now, Eileen, just as I'm talking to you, different bits and things are going to be happening to you, all right? But just for now, I want to find out what's going on and what's troubling you. Do you understand? Yeah, OK, that's fine. Right, so how old are you, Eileen?
92.
What were you doing when you fell last night?
Sitting in bed.
You were sitting in bed?
Yeah.
What time was it?
After the football, about 10:30.
OK, and did you get up to use the commode?
No.
Why did you fall out of bed then?
I
Did you
don't
roll
know.
over? You don't know?
No, I don't know.
And how do you get out and about? Do you walk with a stick or...?
No, I don't walk with a stick.
OK. Who does your washing, cooking, cleaning?
I take my washing down to a cleaners. They do it while I'm having my hair done.
And you get your hair done once a week then?
Yeah.
Oh, well done. You're a shining example. Do you drink alcohol?
Yeah.
Lots?
Well, I say lot.
How much do you drink normally?
I had a brandy and
Yes.
milk.
A brandy?
And milk.
And milk?
Yeah, that's
Once
fine.
an evening, or?
One in the morning and one of the evening.
Seeing as you have got to the grand age of 92, I think if you want a little tipple, we will let you have one. Yeah? OK. Do you get lonely?
Yeah. I never see any of my husband's family or relations.
How long is he dead now?
5 years.
I'm sorry to hear that.
Yeah. And he had Alzheimer's. Horrible looking after somebody like that. I said, because I never knew where he'd be. I always used to find him down the bottom of our road, and he is always down there.
Do you miss him?
Yeah.
How long were you married for?
30-something years.
Oh, a long time.
Yeah.
Now, listen, if I could wave a magic wand, I'd make you being 20 and running round again, but I can't wave a magic wand, all right? But I have got a big hospital here. If there's something we could do to make you happy or happier, would there be anything specific that you would ask for?
Another man like my husband.
All right, well, listen, what I will try and do is take your pain away. I suspect, Eileen, having been on the floor all night, you are going to have to come and stay with us for a bit, all right? Right, let's see what we've got to do with you. Now, whoops-a-daisy. Well, no, let's actually just examine her properly first, shall we? I think hands-on and... All right, are there basal creps?
I'll tell the surgeons, as far as I'm concerned,
All
they should go ahead with it. Now, obviously, the fact that you have got some heart disease will necessarily mean that the operation on the artery in the tummy is higher risk. But leaving it is obviously much higher.
Yeah,
and the
right.
reason they're asking me to come and see is there any way we can optimise the heart? I don't think there is.
No.
That's what I'll tell them.
Good on you. Okay.
Okay, nice.
Thank you. Not much positive anyway.
No, they're all positive. And trouble is we're 77 years old.
I'll be honest, to find out something serious is wrong with somebody, having been through it once with my sister and to go through it again with my dad, I was trying to think about anything else. I was thinking about Dad when he was racing, about Dad mowing the grass, and I was just trying to keep it so that it was normality.
No, you're bleeping again. Oh yeah, according to that, you've got apnea now.
What have I got?
Apnea, you're dead. I'm gonna have to go and move my car.
You know what?
I shall have to move my car in a minute.
What's that? You know I'm here, I'm living.
Yeah, I know you're here, I can see that.
Still be alive at 7 or 8 o'clock.
He's what, Dad? By what?
Probably still be alive at 7 or 8 o'clock tonight.
He says these things almost to tempt fate,
don't
to
worry.
prove him wrong. Where are you going now?
More upright.
You better pull your kilt down a little bit.
I know that pain there, man. I know that pain. I know that pain.
I've never had a knee injury before.
I've encountered that before. I have.
I've never had a knee injury, so it's all new to me, mate.
Yeah, man. I'll tell you what. It's when it rains.
Oh yeah, the coldness.
Yeah, when it rains.
Oh, the coldness.
The change in the atmospheric pressure.
Yeah.
Boom.
So it
That's
starts
when I
burning
feel
your
it.
knees.
Yeah. And so I know. I've got arthritis to look forward to.
Oh, yeah. Yeah, I've got it already. In my hands and my elbows.
Rheumatoid arthritis and all them things there, but
you know,
just deal with it, innit?
I'm gonna have it with the knee now.
That's what it is. You know? And like the people them attract the foolishness. It's not like I'm gonna have to go and volunteer down the local old people's home to make sure I can get my spot when time comes.
You have to book early then.
Yeah,
book in now.
You have to book early.
Book in now.
Yeah, you have to do a couple of years volunteering, and then you get your spot in it. That's what I say.
Yeah, yeah.
But
backwards for no reason at all. I hadn't woken up properly, and I fell onto my and I've really damaged my wrist.
Okay, let's see.
I mean, I had just got on the court. We were knocking up, and it was in the first thing, and I just fell over backwards.
Okay.
It's the men. It's always the men. They're all big boys that have never grown up, do all the stupid things, all the dangerous sports. Yeah. They're the ones that aren't dealing with the pain quite so well. It's usually little old men and ladies that are really stoic, and they come in with a broken wrist that they've fallen over a week ago, and you say to them, you know, why didn't you come in sooner? And oh, I thought it would get better, you know, thought I could deal with it, but they don't.
Do you want some paracetamol? You've just had Nurofen this morning. Do you want something else?
I got some. No, I'm fine.
You're okay with that?
It's quite painful, but
Paracetamol to take the edge off?
No, it's okay, all right. But I've got some ibuprofen in my pocket. Just I haven't taken it. It's okay.
You don't want them?
Let's go through all this without it, and then I'll take one.
All right. And just finish. That's right. Just okay it. Okay. And then if ED.
Babe, I'm fucking broken, babe.
It's broken.
I'm broken. I feel really broken.
Your heart?
Yeah.
Eileen, what analgesia has the GP tried you with before?
I've got some pain relief things, but I haven't taken them.
Right, ever? Never taken them before? One. What was it? Do you remember?
No.
Did it make you feel a bit funny, that one, or not?
No.
OK, one moment, sweetheart.
She needs any pain medicine?
Yes, she does.
Can I have a doctor, Teresa?
Hello, X-ray. Sorry to trouble you. It's Liz phoning, the A&E consultant. Hi, X-ray. I've got a 92-year-old lady who's fallen out of bed and been on the floor all night. My suspicion is she's fractured her left hip, all right? But she's tender over the mid-thoracic area and a number of places along her spine.
Lots of times, there's nothing I can do. We are meant to grow old. We are meant to get ill. And we are meant to die. I can fiddle about at the edges of that, but there's no sort of magical response in here, in this hospital, that can change that. And so when people are older, I think what matters most to me is doing what they want sorted.
I don't really want her languishing in the corridor. I think having been on the floor all night is enough, if you see what I mean. Yes, if possible.
Thank you. Bye.
Still in there, she needs to be thrown out. 3 is now empty, she's gone to recess, 4's gone to CDU. Dudley folks, the guy.
First time I've ever broken a bone.
See what it is out there then. It's been waiting a long time.
You see,
this is horrendous. This isn't what we got handed
Well, this
over.
is exactly what I just said to you. It was horrible when I came on. It's not nice at all. Last night was nice. This isn't nice.
It's not even that bad out there, really.
Okay.
All right. Who's gone out there to help him?
Darren and his girlfriend Alice are waiting to be seen. He's hurt his foot kicking a chair whilst playing a computer game. Sitting beside them is 82-year-old Joyce, who's suffering from a stomach complaint.
Mind you throw yourself over me, you know.
Pardon?
I said, mind you throw yourself over me. Watch it.
Right, do you want to come round? Surname?
Connolly. C-A-N-N-E-L-L-Y.
He was the one that was meant to have had...
Not looking very well now.
Oh, God. I don't know. Yeah. Should we just take him to resus? Let's just go. Oh, God. A minute, yeah. Sorry. Dear. Hi, Charlotte, I'm going to bring someone that's just gone flat with ambulance. I'm going to have to bring them in. Thanks. I'm going to have to bring them in. I'll get a trolley, yeah, he's just suddenly taken a turn. Oh, let me get a trolley.
Is it passed out?
After being brought in by paramedics, 79-year-old Eddie has suddenly lost consciousness.
Okay, get his stuff. Hello?
Can you get a screen, please? Take out.
Hello, sir? Hello? Right, okay.
Yeah, can we move the child out and put News 5, please?
It is, it's all stressful. I've had something just literally almost crashed on me and had to rush around to resus. It's just, what was Fiona saying about it being nice? It's absolutely living hell. That's fine. Okay.
Hello? Are you all right? Good. Right, let's check his BM. It's all right, sir?
I know, I can never find anything.
Yeah, his son-in-law is on the waiting room, but family couldn't speak to him today.
Neither said chap or just unconscious?
I don't know if he had a faint, I'm not sure. But either way, he didn't look too good.
He didn't, did he?
Surname?
Yeah, but he is conscious now, he knows where he is, and we're just going to check the blood gas now. Okay.
It'd be nice just to make sure that what we're seeing on there that doesn't look like he has P waves, in fact is, I mean, this is perfectly regular actually. That's perfectly regular.
I'm glad you're awake. You had a funny turn on me. You've got lovely Charlotte looking after you now. It does make you afraid to get old sometimes. I do fear getting old sometimes. I fear being vulnerable and not in control. But Trolley's coming in.
He is fine now. He's back, but
I'll go and speak to his son. Is his daughter here as well?
I don't know. I didn't have a moment to blink.
I'm sure.
But a trolley will come to you first, and then I'll get my one.
Okay.
I'm gonna fuck you tonight.
Hey, can we go for a split? My lazy tired.
No, what? A split? No.
You buy it.
We'll have a fag, but not a split yet. You can wait.
Oh, I'm not sitting here 3 hours without nothing in me, I don't care.
We'll go out for a fag, but we'll have one soon, yeah?
Can we have one now? Please.
Darren, you're just so... We're outside the fucking hospital. Just please, for me. Just leave it, we're going to have one. And when you do have it, it's going to be nice. Yeah?
Yeah, can we go out and have a cigarette?
Yeah. Don't try and make me change my mind outside, because it's not happening.
Hello, Amy Majors.
Claire, it's Mario here.
Oh, Mario, hi.
Yeah, just give me a rundown. How is the major now?
It's hideous, it's hell. It's horrible.
Right. How many hours?
9 patients waiting 2-hour wait. Well, just let me get on, Mario, and I'll come talk to you in a minute.
Okay.
Bye.
I'm just going to go into 6 to assess this.
Yes, please, that's great, yeah.
Patient in there.
No, the bed is coming back and the patient is in the suture room. Right. Why have they been here 3.5 hours and haven't had an assessment?
Because it's busy, Claire.
Okay.
That's why.
That old lady's rude, man.
Did you hear her? Don't push up yourself on me. That's what he said. He said, don't push up yourself on me. I was like, oh, shut up, man. Come on, gorgeous.
Right, take a seat, I'll get you booked in.
Oh boy.
A bit of genuine sympathy you just squeezed out of me there, Pete. Genuine bit of sympathy.
Genuine bit of shit. You know what they're gonna say? And push me out when they're ready.
Yeah. You take 1 and 2 tablet anti-inflammatory and an antibiotic.
Yeah. And we can't do nothing more for
one
you.
crutch. If
And
you
one
get
crutch.
2, you're well unlucky.
Isn't it?
One crutch and out the door, bro.
Isn't it?
Yeah. King's College special. Patch up, hitch up, 2 tablet, 1 crutch and out the door later. Yeah.
A true thing.
On the road again.
It's a true thing. You're not lying at all.
You mean?
It's like we none of us like we don't know what
I'll come in there, big stab wounds in my face and all sorts of people, them stitch me up, itch me up, 1 tablet.
And try you out the door.
4 o'clock later, yeah. Peace. You know what I mean?
You're just getting a bit wary now. No, mate.
Yeah, for real.
Oh.
You fucking shattered me, man.
Papa. Shit, overtiredness.
Yeah. Straight up and down, man.
Overtiredness, you know
Straight
what I
up and down, man.
Papa.
Okay, your body repairs itself better when you're sleeping anyway.
Yep.
Sure.
Right, we're going now.
All right, thank you.
Do you know what ward we're going to?
We're going to Cotton Ward.
Cotton?
Coffin.
No.
What?
Coffin Ward. Trust you. What was it?
John is being taken to a ward where he'll await major heart surgery.
Do, but everybody else did it. I'll check with the matron when I get back. Keep your arm
Hello, it's Claire. You've got somebody, he's a guy with a beard and he's got bandages on his hand or wounds to his hand. Can you not let him through to majors or minors? Because he's a nightmare. And he was in this morning abusing everybody, shouting. He may have walked out the department, but he may come back. He's got a beard and he's like, rah, rah, rah. He's Irish gentleman, shouts a lot, quite abusive. Cheers, darling, bye.
I might surprise you and go for a nice wax. Meaning that they wax off your hairs.
You're getting wet. I'm getting wet.
What, by a woman, yeah?
No.
It's only women that do it.
Swear down there, man.
Swear down, Mum. Do you really think I'm going to sit there with my legs open and let a man wax me? Are you fucking silly, Dan? Bad enough fucking doing it for you.
I'm not saying a man's doing it. I'm saying all that thing.
Okay. You're not going home tonight, okay?
Home.
Because we need to observe you overnight, okay? To see how your heart is doing, okay? All right? I'm just going to speak to your son-in-law and explain to him what we've done, okay?
Yeah.
Right. I've just spoken to the cardiologist. As I told you, I just don't like the way the heart is. We're looking at things like a pacemaker. Okay.
That's all right.
Yeah.
Okay.
Should the heart rate go down dramatically tonight,
Yeah.
they will have to do that tonight.
All right.
Okay.
All right. So you think obviously he has got a problem with his heart then?
I don't think, I know.
Right.
He has a problem with his heart, yeah, definitely.
Right, okay.
Right.
You might have to have a pacemaker fitted. But don't worry. Nothing for you to worry about. What matters is that you get well again and you've got to stop falling into the bath and things like that. How many times have you fallen into the bath then? More than once? Well, why didn't you ever tell us before? You never ever told us. Hey? You never mentioned that you can get out of the bath.
Don't worry about it.
I want to say something, I don't know what to say.
You've said it all, dear. Said it all. Just do a good job on the next.
He knows. All I was thinking is, please let this come right. Just let's, let them save him. Because, what else can you do? You're helpless, you can't do anything. But on the other hand, of course, you've got to stay strong for everybody else, haven't you? You can't give in.
He'll be all right.
Just told him, Anita.
Yeah.
Don't do this, you'll set me off.
I'm just trying to be... Sorry.
It's all right, dear. Probably better.
Get to you. I've been trying to get to you and tell you all the things that I never say.
Don't worry about it. Don't you start. Someone's got a big stand.
It'll be tough. You're not going to leave me.
I know, all right now.
Now look, you're not loud. No. You know I love you lots and lots.
Yes,
don't
dear,
you,
yes. And I love you too.
Yeah. Don't go and leave me because I can't
No,
manage without you.
God. It just can't be like this because people is people. They
I know, and the thing
live
is,
for
we've
so
all been
long.
there, done that.
This is the best place for you at the moment for a couple of days. Find out what's wrong. You can't keep falling over, Eddie. One day you're gonna fall over and, All right then.
Yeah.
Take care. I'll see you later. All right.
Yeah.
All right. Take care then. See you then.
Everyone should walk through an emergency room at least once in their life because it makes you realise what your priorities are. It's not the rush and the money and the materials and the things. It's the people you love and have around you and the fact that 1 minute they might be there and 1 minute they might be gone. And it doesn't matter how many times you crawl at the ground trying to get someone back, they don't come back. It's so final and it's so shocking, so it makes you appreciate the very simple things of life a lot better.
Hey, sweetheart.
I've scrubbed every commode, filled up everything. Oh my God. How many sickies have you had today? Oh.
All right, sweetheart.
That little one, she's a little madam, she was.
Now, which cubicles don't have blood pressure leads?
Oh my God.
I'm going to write it down because I want them to sort it out today.
Yeah, number 14 looks half and half.
Any kings? 2.
Any idea what he was stabbed with?
Policeman said a samurai sword was seen.
At the weekends, it's time to forget about your stress and enjoy yourself. Unfortunately, I think people enjoy themselves a bit too much sometimes.
Just keep breathing. Come on. Come on.
Do you not do
Sit down. Sit down now.
Why have they put us in here unadvised? There's so many things to play with.
you.